التمارين اللي الحين راح نشرحها هذه التمارين حق اللي عندهم خشونة أو آلام في الركبة بشكل عام ومحتاجين علاج طبيعي لتقوية العضلات. طبعا أكثرهم يتألمون فما يقدرون يسوون التمارين المتقدمة، فراح نقسم تمارين الركبة للي يعانون من آلام إلى تمارين بسيطة أو سهلة وتمارين أكثر متقدمة. فالحين في الفيديو اللي مع توماس الحين راح يورينا التمارين السهلة لآلام الركبة اللي ممكن تساعد في استطالة العضلة وفي تقوية العضلات بشكل عام.
Hello. Today we're going to be dealing with exercises for arthritic knees or knees that are stiff. Now often when this happens you lose the range of motion within your knee and the muscles will weaken accordingly. So what we're going to do is I'm going to show you some simple exercises to begin to strengthen the muscles that weaken within your leg to make your leg stronger and more stable and therefore help to reduce the pain. Now oftentimes what will happen is the muscle that weakens the knee is the muscle in the inside part of your thigh in this region here that we call the Vastus Medialis Oblique or VMO. This muscle here attaches to your sabuna or your patella and its job is to pull the leg up and in this direction. If this muscle weakens, your leg becomes more unstable and this bone then begins to move in this direction, which will start to rub the bone surfaces together and produce pain over time. So what we want to do is strengthen this muscle to make your leg more stable, but also if in the future you need surgery for a new knee or something along that sort of line, this will actually help you recover quicker after surgery. So we want to get the muscle as strong as we possibly can so we can help minimize the pain as much as possible. So this muscle works most often when you're walking. So when you take a step and you put your foot on the ground, this muscle is supposed to contract and work. If this muscle is weak, you'll begin to overuse this muscle group, which will start to pull on your knee differently and produce pain. So what we do is you lay down on a mat or lay on your bed at home. You want to have your knee at about 30 degrees knee flexion, okay? So you want to have your knee bent like so. You want to have the leg turned out. So this muscle belly that is weak is pointing up towards the ceiling. Your body will have a tendency to want to roll your leg in to use a stronger muscle. You need to resist that, keeping the leg out, so this weak muscle is pointing up. And then you want to lift the foot and hold it. Now this muscle has a high fatigue factor. It works often. So you want to hold the contraction for 10 seconds and then lower it back down. Now because this muscle works every time your foot hits the ground, it has a very high endurance factor. So you want to repeat this 30 times. Every hour if possible when you're home, okay? And I would also suggest you do both together at the same time because oftentimes you'll have the weakness on both sides, although you may only have pain more on one knee than on the other. So you can do them both at the same time. It's probably best to do this one at first lying down. So you can lay down flat, have your legs turned out, lift the feet up, hold it there for 10 seconds, and then lower it back down. And as I mentioned, repeat that 30 times every hour when you're home. What you also need to do is lengthen or stretch the muscles that attach to your leg, attach to your thigh specifically. So the hamstring muscles, which are behind your leg, we're going to stretch. And then we're going to work on stretching the muscles on the top part of your leg. And then we'll work on the muscles on your calf, the muscles through here. Making sure the muscles are of good length around the leg is also important as you gain more movement with the various stretches and strengthening exercises you'll be doing. So the first muscle we're going to stretch will be your hamstrings, the muscles on the back part of your thigh. So best thing to do is lay down, have your legs straight. The leg you're stretching is the one we pull up and bend like so. And then what you do, you're going to hold here with your hands. So you put your hands together like so behind your knee. Your hands are not to pull your leg towards your chest, but to rather hold your leg stable in one place. Then you'll straighten the knee like so. Now the harder this muscle works to make your leg go straight, the more it tells the brain to get this muscle to relax. So you want to push for a good solid 10 seconds and then come back down. So you're going to come up, hold for 10 seconds and then come back down. Now when you can get your leg perfectly straight and you don't feel stretching anymore, you can progress it by pulling your thigh to your chest and then repeating the same exercise. So I'm not pulling the leg towards me as I'm stretching. So I'm not making my leg straight. Do this. Don't do it like that. You hold the leg still as you straighten the leg. Once you can do 10 10-second holds and you don't feel it pulling here, you then pull your thigh to your chest. Again, push for 10 seconds. Don't stop. Just keep pushing for 10 seconds to get your leg straight, and then relax, and then do it again. And do it for 10 seconds, 10 times. Now, with your foot position, people will oftentimes ask how to place your foot. It's really not important with this particular exercise. So I would almost recommend that you actually have your toes slightly pointed. Don't pull up, but slightly pointed. That will then stretch out just this muscle, your hamstring. If you pull your foot up, it will start to stretch other structures as well and may not be as effective as having your foot pointed when you're working on the hamstring. So you push for a good solid 10 seconds and then relax. So that's for the muscles on the back part of your thigh. To stretch the muscles on your top part of your thigh, your quadriceps, you can lay on your stomach, bring your legs together, lay down flat, reach around if you can, and then pull your leg to your chest. And hold that for 10 seconds. And relax. Do it again. And repeat that. Now, some people will prefer to do that exercise in standing, but there's 4 muscles. If you do it in standing, you'll miss one of them. But if you do it lying in this position, you will stretch out all 4 muscles that attach to the top part of your kneecap or sabuna. It's best to do it lying down, keeping your legs together. Again, reach around, grab a hold, and pull your thigh to your chest. Now, if your muscle is too tight, so then you can use a towel around your leg. So if you're unable to reach with your hand, you can use a towel. You can take the towel, put it around your leg, grab a hold of both ends. All right. And pull this way until you have good enough flexibility in the leg after repeated stretches where you can eventually reach with your hand. But if you're too tight and you can't reach, then just use a towel to pull and help stretch. So you should just feel a comfortable pulling sensation inside the thigh. If you start to feel pain while stretching inside the knee, back off and only do the stretch when you're feeling it in the muscle, anywhere from your top of your sabuna up to your thigh. This is the region you should feel the stretching in. It'll be anywhere within that region, between those 2 points. If you feel pain in the knee itself, then stop the exercise at that point. So again, you can take a towel, put it around your ankle, and then pull it towards your heel. So your goal is to get your heel to touch your buttock. Hold for 10 seconds, relax, and then repeat it 10 times, at least 3 times a day. Very good. Now we're going to stretch the muscles on the back part of your calf, this region through here. There are 2 main muscle groups in the back part of your calf. Ones that cross the knee and the ankle and have an effect upon both, and ones that cross the ankle only. So the best way to stretch out the muscles in your calf is to use your body weight to stretch it. So you have 1 foot forward, 1 foot back on a step. So you can do this on a step or on a curb. You have the edge of the foot, or the ball of the foot, right on the edge of the step. And then what you'll do is you'll drop your foot down, and you'll hold that for 10 seconds. So as you push down, keeping your knees straight, you'll feel the stretching throughout the back part of your calf. You come back up and then go back down. So you're going to do 10 10-second holds on one side, and then repeat the same thing, of course, on the other. And you'll feel a nice, comfortable stretch while doing this exercise. Try to keep your body straight. Don't bend your body forward to try to do the stretch. Keep your body straight and allow your body weight to lengthen and stretch the muscle. Okay? When you get done doing it with your legs straight, then bend the knee a little bit and drop it down. Now you'll feel the stretch a bit lower. When your knee is straight, you'll feel it through the whole muscle. When your knee is bent, you'll feel it in the ankle area. And so you'll hold that again for 10 seconds. Repeat it 10 times on one side, and then do the same thing on the other. I prefer this exercise Many times people will do it lying on the ground with 1 foot forward, 1 foot back, and then leaning forward. This is an exercise that a lot of people will do, but your body weight will compress the ankle joint and you won't get an effective lengthening effect. So I find the one on the step works best because you can use your body weight to stretch and lengthen it and get the full movement in the ankle joint as well as within the muscles themselves. So again, hold it for 10 seconds. 10 seconds allows the muscle fibers to lengthen. Repeat it 10 times for maximum effect. Of course, repeat on both sides. And repeat with your knee straight and with your knee bent. And ideally, I would suggest you do this 3 times a day, and best to do it before and after you go for a walk. So if you know you're going to go shopping, do it before and after. If you know you're going to go for a walk to get some exercise in, do this before and after. So the progression from doing the exercise lying down with a pillow underneath your knee is to do it in sitting. We do it in sitting because now we have a longer movement of your knee. Again, the VMO is the muscle that's weak. We want to make sure that this is the muscle that's working. So you're going to have your leg fully supported by a couch or by have your legs turned out, so that muscle belly, which is weak, is pointing up towards the ceiling, and then you're going to straighten the knee. Again, you're going to hold that for 10 seconds, lower it down, and then do it again. And you want to repeat that 30 times. Again, to save time, you could do that on both legs at the same time. You want to feel this muscle working. Now, if you're having a little experiment at home to see whether the muscle is working or not, as you go to lift your leg up, you can actually have a feel of the muscle on the outside. You'll feel it's fairly firm. The muscle on the inside will be spongy if it's weak. So you can push right into it. It'll be almost non-existent. As you're doing the exercise, you'll feel it firming up as it gets stronger. And again, you want to repeat this 30 times, high repetition, because every time your foot hits the ground, this muscle is supposed to work. And back down. So again, do 30 10-second holds every hour or so when you're home. Now, when you're walking, we spend 70% of the time with walking staying on one leg, if you think about it. So one leg, one leg, one leg. Most of walking is staying on one leg. So if you're having pain within your knee, we also have to get the muscles around your leg strong enough to stabilize your knee while walking. So since walking, as I mentioned, is standing on one leg, your sense of balance may be off a bit. So I suggest what we do is you stand next to a table or a couch, and basically you bend your knee a little bit, because when you walk, you don't walk with your legs straight, you walk with your legs slightly bent, and you're just going to lift your foot slightly. You don't want to lift up too high because you're not marching when you walk. We're trying to reproduce what happens when you walk. So you just lift up your leg a little. You can actually hold a couch or a table, something to help steady yourself, because this exercise is a strengthening exercise as well as a balancing exercise. So effectively, you want to do this for a 4-minute period of time. That's your goal. You won't do it all at once, but that's your goal. When you can feel quite comfortable and confident in how the muscle and leg feels, you can begin to remove your hand from whatever object you're on. Count maybe how many times in 4 minutes you need to touch to steady yourself. Maybe the first time is 20 times, that's no problem. Then 18, then 15. Eventually you'll get down to none, where you can do it for 4 minutes on both sides without touching. That's your goal. So if you can do it for 4 minutes without touching, your sense of balance and your strength of your leg has begun to increase to have you walk safely and be able to stabilize your knee and help to minimize the pain you would have while walking.